Hello, this is Dr. Mike, and let me take a few moments to tell you about our upcoming Medical Exercise Program Director Study Group. It starts on September 22nd. We still have slots available. And please remember, the Medical Exercise Program Director serves as the liaison between the medical community and the fitness facility. This is the individual that doctors, therapists, and chiropractors go to ask, what exercise does my patient need to help improve their level of function? The Medical Exercise Program Director also is the individual who educates the medical exercise training staff and gives them advice and helps them manage their clients better. As well as the Medical Exercise Program Director also goes out and promotes, develops, administers, and more importantly, manages the medical exercise training facility. The Medical Exercise Program Director usually has a number of years' experience. They work with a wide range of medically based clients. They've gone through the MES or PRCS program, and now they start to realize that medical exercise training is their niche. It's what they want to do. And now they want to get more training so they can be more efficient as a program director. They can become more efficient as a manager. But most importantly, they can produce a program that produces outcomes, is profitable, and connects with the medical community. If that's what you're looking for, then our medical exercise program director is for you. So if you would, the role of the Medical Exercise Program Director is to develop, administer, market, and promote a medical exercise training program in any facility. Whether it's your program or you're working for a health club or a hospital-based program, you're the person that will do this, as well as educating the medical exercise training staff, educating medical professionals in the community as to the benefits of medical exercise training, as well as also educating the public with regard to how exercise could positively impact their medical conditions. As part of the Medical Exercise Program Director Study Group, you'll have access to our MEPD clinical modules. These modules include advanced post-rehab guidelines for the knee, the shoulder, the spine, pharmacology for fitness professionals, ergonomics for fitness professionals, essentials of senior fitness, and our MedFit assessment series. Now, these clinical modules are self-paced and are part of the MEPD program. In that, once you register, you'll receive an email from us that will give you access to our MEPD members area. You'll receive a username and password, and you can go in immediately and download these video modules and get started right away. You'll also have access to our MedFit assessment modules. Now, as I said earlier, the MEPD serves as the liaison between the medical community and the fitness facility. This person must have a great understanding of the special testing procedures, the assessment process, the medical history taking process that is seen commonly in a medical setting. Maybe they don't have the same level of proficiency the doctor, the therapist, the chiropractor does, but they at least need to have an idea of what special testing procedures are done, how to perform goniometric measurements, how to perform manual muscle testing procedures, and most importantly, how to appropriately manage these clients, get histories, and determine if a client is appropriate for medical exercise training or needs to be referred back to their doctor, therapist, or chiropractor. So in our MedFit assessment series, you'll learn how to assess the shoulder, the lumbar spine, the cervical spine, the hip, the knee, the ankle, foot, as well as the elbow, wrist, and hand. These are all self-paced modules that are part of the MEPD program that you must complete by going through, watching each one of the video modules, and then completing the quiz that goes along with it. Our live presentations, and you can see below this video a series of dates, the live presentations look at the idea of our medical exercise training systems modules. One of the key things I've noticed over the last 10 years as we've helped individuals move their practices from a fitness or personal training studio to more of a medical exercise training facility is there are a number of systems that must be implemented to actually make the transition. And we find if you have experience working in a medical environment, you understand these, but if you've exclusively worked in the fitness arena, then now we find implementing these systems is a little bit difficult. So our primary focus in the MEPD program is getting you up to speed on implementing the necessary systems so that you can have a more effective and more efficient practice, have a more profitable practice, but also produce the outcomes necessary to attract referrals and develop referral relationships with medical professionals. These systems allow you to become much more efficient, to make sure nothing falls through the cracks, and manage your clients more appropriately. So we'll go over systems implementation for operations, client management, assessment, documentation and communication, which are two of the most important. Marketing, we'll even give you a system for marketing as well as a system for developing and maintaining medical relationships. We'll look at a system for multiple streams of income. We'll also look at how to develop the business plan as well as a scheduling system, a billing system, and a system for staffing and also educating your staff. These are all systems that we'll go over in our live medical exercise training systems modules that are part of our MEPD program. The MEPD program requires you complete the following. You complete all the clinical modules, turn in all the quizzes and the assignments associated with the clinical modules we went over earlier. That you participate in the medical exercise training systems modules. Now, each one of these modules is presented via Google Hangouts, which means you can actually participate in the live streaming, watch the live streaming, but each one of the sessions is recorded. So if you can't make a session, just simply go in, view the recording, and make sure you complete the homework assignments that are assigned with the individual METS modules. Also, you must have a recorded presentation. You must complete one. You must do a presentation, record it, and then make it available to the medical exercise program director faculty members. One of the keys here is, as a medical exercise program director, your job is to market and promote the medical exercise training facility, as well as educating staff members, medical professionals, and the public at large, which means you must be able to make a presentation. So one of the requirements is that you must complete or make a 30-minute presentation to a group of your peers, other fitness professionals, medical exercise professionals, and it must be on a topic related to medical exercise training. This presentation must be videotaped, and you must provide us with your PowerPoint presentation. So you have to develop a PowerPoint. The reason we do this is because once you become a program director, you're now going to be responsible for doing those types of things. Then also you have to complete a fictitious business plan. Now, as a program director, you may be called on to develop a medical exercise training program for a health club owner, or you may be the director of a hospital-based fitness center, or you may want to develop your own medical exercise training practice. All of these require the development of a business plan that includes projections, budgets, as well as marketing concepts. So, as part of the MEPD program, these are some of the requirements you must complete, and we'll help you with these requirements. The goal of the MEPD program is for you, the medical exercise program director, to bridge the gap between healthcare and fitness. You can see here with our slide, we have a medical professional who's holding a dumbbell in one hand and a chart in another hand. You, the medical exercise program director, will be the catalyst for this transitioning, this bridging the gap between healthcare and fitness. So if you're an experienced medical exercise professional, you've worked with a wide range of medically based clients, you've now moved into more of a management type of situation, and now you're looking to become a better manager, make your program more efficient and more effective, and increase profitability, then I urge you, go over to medicalexerciseprogramdirector.com, register, or just simply look below this video. Look at our start dates. We start on September 22nd. Look at all the dates that we have, and you'll find below a button where you can register. Now, if you register before September 21st, you'll only pay $900, and that $900 registration will also give you access and a ticket to attend our MedX Pro Summit that will be held here in Houston, October 24th through 26th. If you can't attend, all the segments will be videotaped, and as a MEPD participant, you'll get access to all those videotapes. So thank you again for watching this video. We wish you the best in building your medical exercise training practice, but please, if you would, look at the idea of becoming a medical exercise program director. Our MEPDs will be the catalyst for bridging the gap between healthcare and fitness over the next 2 decades. If you want to be a catalyst, join our program. Thanks again, and best wishes to you.